Good morning, everybody. Yesterday was a record of 110,000 people in New South Wales who got the jab, who were vaccinated, and that is a phenomenal outcome, and I encourage everybody to please come forward and get vaccinated. To date, we have 5.5 million jabs that we've given in New South Wales. 53% of our population has had at least one dose, and 28% of us are fully vaccinated. And obviously we want to see these numbers climb as quickly as possible. So thank you to everybody coming forward to getting vaccinated. In the last 24 hours, we had 119,000 people come forward to get testing. We had 681 cases of community transmission, with 59 at least infectious in the community during that time. And we extend our sympathies and condolences to the family of a man in his 80s who died at St George Hospital in the last 24 hours. He'd had one dose of the vaccine and did have underlying health conditions. And we extend our deepest sympathies to that deceased man and to the family of that deceased man. In relation to the areas that remain a concern, Western Sydney and South Western Sydney are generating the vast majority of our cases, and I'll go through the suburbs of concern, but we also have with us today Commissioner Shane Fitzsimmons from Resilience New South Wales, who has been working closely with government and non-government organisations in those communities to make sure that people are well supported and make sure they have every opportunity to stay within the rules in relation to the virus. In relation to the suburbs of most concern, Marylands, Guildford, Auburn, Granville, Lidcombe, Greenacre and Blacktown are the suburbs that Health wants us to call out today. They are the areas where there's the fastest growth in cases. It doesn't mean there aren't other areas that we're concerned about, but they are the main ones, and we ask everybody in those communities to assume, first of all, you should be staying at home, but assume the second you put foot outside your door that you have the virus or anybody you're coming into contact with has the virus. In Western New South Wales, we remain concerned with the cases bubbling along, especially around Wilcannia and Dubbo, and the Deputy Premier will give an update on what is happening in the regions. Things are settling down in other parts of regional New South Wales, which is positive, but obviously our concerns remain about Western New South Wales in particular. I also want to announce, and the Deputy Premier will reinforce this as well, that given the outbreak in Western New South Wales and a few cases elsewhere throughout the regions, that the lockdown in regional New South Wales will align with the rest of New South Wales. So until at least the 28th of August, all of regional New South Wales will also remain in lockdown as a precaution. We know that there are vast areas of regional New South Wales where there aren't any cases, but everybody would appreciate and expect us to take a precautionary response, given we have the opportunity to get down to 0 cases in the regions. That's certainly what we want to achieve, and therefore we're taking that precautionary response. As I mentioned at the outset, New South Wales is already up to 5.5 million jabs, and once we get to 6 million jabs, those that are vaccinated will have the opportunity to be able to do something they can't do now. And I really want to stress how pleased I am with the number of people that have responded to vaccines and coming forward. I want to remind the people of this state that once we get to the end of October, we expect 70% of our population to be fully vaccinated, and once we get to mid-November, we expect 80% of our population to be fully vaccinated, and that gives us enormous opportunities to have greater freedoms than we do today. I also wanted to encourage again anybody between the ages of 16 and 39 who lives in those local government areas of concern throughout Western Sydney and southwestern Sydney, please come forward and get vaccinated. The federal government gave us 500,000 extra doses of Pfizer, and we have 2.5 weeks to get it out to everybody. So please come forward, go online and book. You'll be given priority. We know that age group in particular are the ones that are having to work, the ones that kind of are the conduit between generations, and we know that around 3/4 of all cases in those areas of concern are people under the age of 40, and for that reason we're really focusing on those rates. I know these are challenging times, but I also can see the light at the end of the tunnel. These are difficult times for all of us, and the next few weeks will be hard. But know that once we hit those high vaccination rates, life will feel much better. Life will look much rosier. And I appreciate what we're going through is difficult. But every state in Australia will have to come to terms with the fact that when you get to a certain level of vaccination and start opening up, Delta will creep in. We can't pretend that we're going to be 0 cases around Australia of Delta. As the Doherty report says, once you get to 80% double doses and you have to open up, everybody's going to have to learn to live with Delta. Admittedly, in New South Wales, we're learning that earlier than others. But having said that, what I'm absolutely convinced about is New South Wales can lead the way in making sure we keep people out of hospital, reducing the deaths, and making sure that we provide our citizens the opportunity to live as freely and as safely as possible. And whilst every single death is a horrendous tragedy, what we need to ensure is that through high rates of vaccination, if we keep people out of hospital, we keep people out of intensive care, we stop people dying, that means we're starting to live with COVID. But I want to manage those comments with the fact that everything we need to throw at reducing the case numbers. So whilst the high vaccination rates gives us those opportunities to live more freely, it is not in any way a comment that we shouldn't get the case numbers down. We absolutely need to. We need to turn the corner. And that's why we look at every opportunity we have, especially in those areas of concern, of what more we can do. And Commissioner Fitzsimmons will speak about that as well. So now I'll ask Dr. Marianne Gale to give the health update. Deputy Premier will talk about regional New South Wales. Deputy Commissioner Warboys will talk about police compliance activity, and Commissioner Fitzsimmons will talk about our activity in those areas of concern. Thank you.
Thank you, Premier, and good morning, everybody. There were 681 locally acquired cases of COVID-19 reported in the 24 hours till 8 p.m. last night. There were 3 overseas cases also reported to 8 p.m. last night. As the Premier said, we had almost 120,000 tests done until 8 p.m. last night, and again a big thank you to the people of New South Wales for heeding that message around coming forward for testing very promptly if you have even the mildest of symptoms. In hospital, there are currently 474 cases. 82 of those cases are in intensive care, and 25 cases are currently requiring ventilation. Of the 82 cases who are in ICU, 71 are not vaccinated. Sadly, New South Wales Health has been notified of the death of one person who had COVID-19 till 8 p.m. last night, and that is a man in his 80s from southeastern Sydney. He died at St George Hospital. He had received 1 dose of vaccine and was also being treated for another serious medical condition. And as the Premier has extended her sympathies, I'd also like to extend my sympathies on behalf of New South Wales Health to the family of that man who passed away. This brings the number of COVID-related deaths in the pandemic to 117 so far, and 61 deaths since June 16th. I'd like to provide a bit more of an update around the situation in Western New South Wales, which, as the Premier said, is deeply concerning to us. There have been 25 new cases of COVID-19 reported till 8 p.m. last night in Western New South Wales, and that brings the total in the local health district to 167. We do ask all the people, all the population of Western New South Wales to really be very vigilant for symptoms, to come forward for testing, as I know that many people have already done, and please take up any opportunity to get vaccinated as soon as you can. We are concerned about 3 cases overnight notified in Wilcannia. Those cases are going to be included in tomorrow's numbers. And we are very concerned about the risk of community transmission in Wilcannia, and we call on anyone who has been in or near Wilcannia in recent days to please get tested. In the Hunter, New England area, there are 5 cases, and bringing the total cases in the LHD to 150 since early August. I'm pleased that all 5 of those cases in Hunter, New England are linked, which is good news. In terms of sewage detections, we have had sewage detections in a couple of areas where there are no known cases currently, and that is in Foster, in Batau Bay and also in Yamba. So I do encourage the populations of those areas to please come forward for testing as soon as you can. Thank you.
Well, good morning. Can I also start by offering my sincere condolences to the family and friends of the loved one that was lost overnight, and you remain in our prayers and in our thoughts. As the Premier touched on, the New South Wales Government, the Crisis Committee made a decision overnight to extend the lockdown for regional and rural New South Wales for an additional 7 days, or to align it to the 28th of August timeline in line with Greater Sydney. The decision for that was based on the numbers that we've just heard. Numbers like in Western New South Wales, 25 new cases overnight, and they were spread in areas like Bathurst had a case, Brewarrina 2 cases, Dubbo 20 cases and Mudgee 2 cases, taking the total new cases, or the total cases in that area, active cases, to 167. Cases in the Central Coast, 1 in Gosford, 5 cases in Newcastle. There was a case in southern New South Wales yesterday reported in Goulburn, and on the mid-north coast, South Kempsey, a case. Since the 8 p.m. reporting period overnight, we know that we've got more cases in Western New South Wales, in southern New South Wales, Hunter, New England and the Central Coast. So therefore it's starting to show clearly that there are still concerns in regional and rural New South Wales. We know of this morning there are now 2 new cases in Queanbeyan. And of course we know that the escalating crisis that is occurring in Canberra is causing that surround, like Goulburn and Queanbeyan, issues. And that's why we've got to continue to be very worried about the regions. Sewage surveillance in Batau Bay, Foster and Yamba, on top of the sewage surveillance that we've seen in previous days, has always given us a level of concern. And that is why it is right that we stay in front of the curve, that we stay in front of the spread, and we keep regional and rural New South Wales in lockdown. And my message to everybody continues to be to make sure we stay vigilant, to get out and get tested if you have symptoms. Those extra 3 cases overnight in Wilcannia continue to be worrying as we see an escalation of cases in that region. And for Western New South Wales, the far west and now southern parts of New South Wales really means get tested if you're not feeling well. And of course, my message is always get vaccinated. And we've got AstraZeneca and Pfizer available across the state in many access points in regional and rural New South Wales. So get online, book in and get vaccinated. Thank you.
Thank you, Premier. Good morning, everyone. 671 penalty infringement notices issued right across New South Wales in the last 24 hours. Of note, 393 of those were issued to people who were out of their home or their residence without a reasonable excuse, which is terribly concerning when you think about the messaging every day here and through the media around people staying at home and not leaving home unless it's for those essential reasons. So 393 people in the last 24 hours detected by police out and about, and some of those examples, a group of young men at Smithfield who decided to set up a soccer field and go about playing soccer. They were spoken to by police. They absolutely knew that they were doing the wrong thing. They were issued with infringement notices and told to go back to their residence. And another example is a man who travelled from Bondi to southwest Sydney. The 4th time that police have spoken to this man, and of course his time's up. He was arrested. He was taken to the police station. He was charged with that offence, and he was bail refused and will be put before the courts. So here is a person that on 4 occasions just blatantly disregards the public health order. And both of these incidents, it's not just about the person themselves, it's about their family, it's about their community, it's about people who openly go outside the orders and put everyone at risk and continue to keep us in this lockdown situation longer than what we might normally do. I'd also like to reassure people that up at Newcastle already the Australian Defence Force is working with police. Nearly 400 people visited up there yesterday. Those people who were meant to be isolating or meant to be quarantining in their home, they were visited by ADF and police. And of course today we have ADF on the ground at Dubbo to work with police out there in relation to people who should be staying at home in terms of the directions by health. those ADF arrangements at Newcastle and also particularly out at Dubbo will be shared across those areas of greatest need or where we think we can get the best results in terms of contact tracing and making sure those people remain isolated from the community. Thank you.
Thank you, Premier. Deputy. The crisis is extraordinary and no more than in some of those focus areas of the Sydney Basin, the focus LGAs of Sydney Basin. And I just want to do a big shout out today to say a sincere thank you. The overwhelming majority of individuals, of families, of businesses, of community leaders have been working with and in conjunction with government and non-government organisation, providing guidance and assistance and the necessary details to ensure that we make provisions and assistance and supports available to those that need it most, and importantly, to seek to suppress the spread throughout these communities. They're focus LGAs for a reason. The complexity and the challenges cannot be overstated, but through extraordinary partnerships across government, Multicultural New South Wales, customer service, health, police and emergency services, an extraordinary array of organisations across the state government, through our Commonwealth partners, Services Australia, through health and ADF and others, but importantly through local MPs, local councillors, local mayors, local governments, general managers and our community partner organisations, organisations like the Red Cross, Salvation Army, health and mental health services and support services. You name them, we've been in this together. And taking the guidance and the assistance means that we've been able to focus in a number of key areas around the nuance that's needed to accommodate the challenges and the circumstances that we rely on as a broader population to have viable operations occurring in these focus LGAs. Whether that be focuses around vaccinations and options for increasing vaccination rates, testing options and testing arrangements to ensure we get increased testing, surveillance testing, symptomatic testing, testing and isolating away from work, supports for community-led organisations and initiatives, partnering with local community leaders, religious leaders, business leaders, our elected leaders, all those leaders coming together to support one another and provide assistance and guidance on what works best is resulting in change, is resulting in improvement. Support and payments to businesses to help them be compliant, to help them have safer operating venues and limiting the mobility throughout those areas. It's been an extraordinary effort, and what we don't understand too often is that increasingly we learn that with the complexities and challenges and the extraordinary high proportion of infections rates throughout these communities, and we can't ignore the fact that we still see 85% of our daily cases centring around the focus LGAs. What we've also got to realise is that we are also critically dependent on the extraordinary men and women throughout these focus LGAs to keep us going. We identify that some of our transport services, some of our environment and waste services, our food distribution networks and our distribution centres and our goods getting out into supermarkets that we need and we rely on, you're talking 60, 70, 80% of the frontline critical workers are in these focus LGAs. So having a nuanced approach, a partnership that extends all levels of government and in particular community organisation is yielding benefit. We've got a long way to go, there's no doubt about it, but the inroads are being made and we're seeing that local approach, that engagement right across the emergency management arrangements here in New South Wales, extending out to provide the nuanced support and assistance that's critical to some of our more vulnerable and at-risk communities right across rural and regional areas of the state. So my message today is a sincere thank you to all the partnering, all the support, and particularly those communities. The overwhelming majority of who, 99% of people, individuals, families, businesses, are doing the right thing. We will continue the focus through Mr Warboys and the team on compliance, but we can't lose sight of the fact that everyone is doing their part as much as they can. The lockdowns, the limitations, the restrictions, the conditions that we face are challenging. There is no doubt about that, and there's no point dancing around the narrative. It's problematic, it's challenging, and I don't support the phrase social distancing. As a matter of fact, what we're talking about is physical distancing. Now in these tough times, more than ever, we need to be socially connected. We need to be reaching out, checking in on one another. making sure that we're looking after our own welfare and that of our loved ones, our families and our networks. But we do it virtually. We need to maintain the physical distance. We need to stay at home. We need to follow the rules. But now more than ever, we need to reach out and support one another. That text message, that phone call, that video chat, they are so important. And right now, we need to lift our spirits. We need to focus on the fact that we will get through this awful time, but we'll do it together, and we'll do it through looking out for each other and accessing and utilising the supports and services that are available. We'll give you the assurance that our efforts are resulting in extraordinary distribution of goods and materials and support and care services. Just in the last few weeks, last couple of months, something like 1,600 tonnes of food products in hampers, of personal care packs, the basic things around sanitary products and all those sorts of things are being distributed to those that need it most. Yes, there's been an extraordinary high proportion in focus LGAs, but it's also occurring right across the state. We'll continue to do that proactively, and for those in need, reach out through your local community organisations, reach out through your local council. We'll continue to partner with health and particularly support those that are forced into isolation for positive cases, but also there's access points through our Service New South Wales website. We will get through this together, and we want to make sure that people know the support and assistance is out there, and we're ready to provide that as and where is needed. Thank you.
Can we ask in regards to, again, you've repeated that in less than 2 weeks, if we get to that 6 million jabs and we're on target, that there is going to be something that we can do for fully vaccinated people that we can't. Can we please, it's a week and a half away, have a hint of what that's going to be?
Look, I know everybody is waiting to know what life looks like after we hit 6 million jabs. More importantly, what September and October looks like, and we're working on those proposals as we speak. But it's for me really important to get the two messages out there. The higher the vaccination rates, the more people are protected, the less deaths we'll have, the less people that will be in hospital and ICU, the less pressure on our health system. So it's really important for us to have those high vaccination rates. But it's also really, really important for us to redouble our efforts to get the case numbers down. And Commissioner Fitzsimmons talked about some of the efforts we're doing to support communities during this time. But there's no doubt that we need to increase our focus on those local government areas of concern. And every day government considers, through the health advice, through police advice, what more we can do in those communities to get those numbers down. And it's really important for us to have that double focus to make sure we can get those case numbers down, but also to make sure we get those vaccination rates up. And yes, when you do have that 6 million jabs, when you do have the 70% double dose, the 80% double dose, life will feel and look a bit better. And as soon as we can, we'll talk to the community about that. But what we want to be very clear is that September and October will be difficult for New South Wales. We've never shied away from that in recent weeks. It will be difficult for New South Wales, but it will be better than what we're experiencing today because more people will be vaccinated. And once we get to 80% double doses, obviously the community will be much more protected, there'll be many more people vaccinated. And so it's really important for us now, whilst we're in lockdown, to really think about who is vulnerable in our community, who hasn't had vaccination yet. Let's consider supporting them getting vaccinated so that when things get easier for us, people aren't left vulnerable because they don't have the protection of the vaccine.
You've been making these vague promises for weeks now about what we might be able to enjoy. You say you can see light at the end of the tunnel. Why are you keeping everybody else in the dark?
Well, this is about making sure that we provide the best information at the right time to the community. We're at 5.5 million jabs. And when we get closer to that 6 million, of course, we'll communicate that to everybody. And I think the vast majority of our citizens understand that. There is no rule book for the Delta strain. Things that worked previously don't necessarily work now. But what we're doing is making sure that every part of government is involved in fighting the Delta strain, every part of government. And I want the community to be assured that the New South Wales government is not leaving any stone unturned. We're working with non-government organisations, businesses, community leaders on the ground, of course our health and police experts. We're not leaving any stone unturned, but we know the case numbers aren't going where we want them to go. We need to ensure that that changes, and we're looking at every opportunity to make that happen. But we also appreciate, and most people get this, that the higher the vaccination rates, and we're seeing around the world communities that have got vaccination rates higher than ours, not very much higher, are living life more freely. But obviously they come from a different base. They come from a different starting point. We came from a starting point of having no cases. But what we do need to do by mid-November, and this is what the Doherty report says, and this is really important, by mid-November the conversation has to be around not so much the number of cases we have, but how many people we're keeping out of hospital, how many people are in hospital. And that is a conversation that we need to continue having, because according to the National Cabinet, according to the Doherty report, once we hit those 80% double doses, the focus will be on keeping people out of hospital, keeping people safe, and keeping people living as freely as possible.
But Premier, isn't it? But Premier, isn't it confusing for people? Premier, isn't
Ursula.
it confusing for people?
Premier.
When you say
Ursula.
that you announce 600
Premier, I don't even know what to do.
That's okay.
Premier, you mentioned the other states. You said that they're going to have to learn to live with Delta just like us. But the problem that we've got is that they're not going to open up to us even if we have 80% vaccination, if we have cases anywhere near like we do today. This means that everything's off the table. Christmas is off the table for people. We won't be able to leave this state, will we? Have you got any guarantee from those states that they would
Well,
open?
I think it's way too early to jump to any conclusions like that about what the rest of Australia might be doing once New South Wales hits at 80% double doses. But these are things that we've faced during the pandemic. I appreciate how upsetting it's been for people who live or have relatives in other states not to be able to visit them at particular times. But every state is going to have to confront the prospect that once we accept that we can't live in our bubble forever, and of course New South Wales, because of our situation, is confronting this challenge earlier than what we'd hoped we would. But the challenge is that every state has to live with the fact that once you get to 80% double doses and your population is allowed to live more freely, that the Delta variant will creep in because we're so connected. And that these are the difficult decisions that our nation has to deal with. But to assume that forevermore there'll be zero cases around Australia is, I think, an assumption that nobody can really make at this stage, because we know that once you open up, once borders come down, once there's a prospect of international travel, something we're all looking forward to, we do need to coexist with Delta. And that is why it's so important for us, while New South Wales is going through this difficult time, the silver lining is getting our vaccination rates up as high as possible. And can I say that in New South Wales, our vaccination rates are almost equal to some of the fastest vaccination rates around the world. We're doing really well, and we need to keep that momentum going to hit those targets. And I can't encourage that enough, because we know that as tragic as the number of deaths are, it would have been far, far worse had a certain percentage of our population not been vaccinated.
What about Isn't it confusing for people when you stand up and announce 680 cases a day, and then you also in the next breath say that you are looking to do everything you can to bring those case numbers down, and then in the next breath say that you are looking to ease restrictions?
No, I think the key message which people understand is that the higher the vaccination rate means that less people will end up in hospital. That means if you're fully vaccinated, you are very much more protected than someone who isn't vaccinated. And come mid-November, and all the other states around the nation are going to have to come to terms with this as well, but come mid-November, when we're at 80% vaccination, decisions will need to be made as to how freely we can live, and that will depend on the case numbers, but life will be much freer than what it is now. But I don't think anywhere in Australia will be able to claim that Delta won't be part of our existence, because that's what the disease does. It is insidious, it's infectious. And that's why the quicker we can vaccinate our most vulnerable, the quicker we can vaccinate those who are out and about because they're active, it protects them against hospitalisation, but it also reduces the speed of the spread, because we know that if you don't have any vaccine, you're more likely to spread it to everybody in your household instantaneously, as opposed to other strains where maybe a couple of people in your household may have got the virus. So I think people understand that the strategy is dual. The strategy is, firstly, get the case numbers down as much as we can, but also get our vaccination rates up, because what we need to do is keep people out of hospital, stop people from dying, and that is the real measure that we will have to measure ourselves by. It's keeping people alive and well, but also allowing our community to live more freely than what we are today. And that is a message most people get. Otherwise, 106,000 people wouldn't have come forward to get the vaccine in the last 24 hours. I'm so grateful for that. Thank you. Thank you for respecting and appreciating how important that is, because there's no doubt the higher the vaccination rate, the less stress on our hospital system.
Premier, thank you. Premier, parents would love to know, are kids going to be back in school at 70% at the end of October, or is it 80% in mid-November?
Look, Can
you give an indication?
Sure, we're obviously looking, well, we have started developing our plan for return to school, but we have to accept that Delta works in different ways to previous strains of the COVID vaccine, to the COVID virus, and therefore we need to consider vaccination rates in the broader community, and also whether children between a certain age need to get vaccinated as well. So clearly we know that the vaccine is available or is regarded safe for children between 12 and 15 years of age, and our health experts in education have already started planning work for what is a safe way to have kids go back to school.
So just
and as soon, can I just finish my sentence? And so as soon as we are in a position to convey that information to the community, we will, but we're not about to make any decisions which compromise the safety of our children. But we also need to appreciate, as we all well know, the pressure on families with homeschooling. So health and education have already started planning work for what is a safe way for kids to go back to school and what that means in the vaccination program. But I also want to stress this is why some weeks ago the New South Wales Government took the initiative to vaccinate Year 12s, especially in those local government areas of concern, to make sure they can sit the HSC without concerns of spreading the virus. And certainly, as I've said, getting people back to work, getting kids back to school are our priorities, and we're working as hard as we can to have a safe plan moving forward.
It is, we're almost at the end of term 3. Is it safe to say that kids aren't going back in term 3?
Oh, look, I don't want to say anything until we have our concrete plans in place. But I will say that we won't compromise the health and safety of our children. We need to get the adult vaccination rates higher to make sure that we have those opportunities in term 4 and term 3 possibly. But these are all matters that we're looking at right now. But it's really important for us to make sure first and foremost that we support our Year 12s doing the HSC all across the state. They're required to sit for public examinations, and I'm as keen as anything as a priority to make sure our students are safe and sit their exams, attain the HSC and look forward to a much brighter 2022.
Premier, you say there is a light. Premier, you say there is a light.
There
is a light at the end of the tunnel that you can see, but there are still around 4,000 mystery cases that you haven't yet sourced. Doesn't this suggest that the virus is still moving around unchecked in the community, and that we perhaps don't have a grasp of where it actually is?
Well, that's the way Delta works, and the positive thing about there's a couple of positives. One positive thing is yesterday we had over 119,000 people come forward for testing. So the higher the testing rates, the more confidence we have that we're picking up all the cases. But there's no doubt that even initially in the first few days when we had 11 cases, it could very well be the case that the virus was lurking in the community unbeknownst to us. So that could very well be the case. But that's always going to be the case. It doesn't matter what situation we're in, that's the way Delta works. It's insidious, it's contagious. And that's why, in due course, we have to learn to live with it. And that's why New South Wales is on a pathway to making sure we get those vaccination rates up, to make sure we have those opportunities to live life more freely, but also to accept what the Delta strain is. Put it this way, COVID never had a rule book. The Delta strain is no rule book on steroids. We are in uncharted territory as far as Australia is concerned, but we've seen what Delta has done overseas. We've seen how communities have responded, and we also know what best practice in other communities looks like. And high vaccination rates are absolutely critical to having communities stay out of hospital, to having people stay alive and well, but also live life more freely. And that is what we're focused on. We're focused on the roadmap, we're focused on the light, we're focused on the way in which we can move forward and really accept that, you know, we haven't had to face these challenges before. We haven't had to think about what does high vaccination and case numbers mean. And these are the challenges that I intend to work with my colleagues, with the Prime Minister, These are challenges for Australia, and we've always said in New South Wales we're part of Australia. It's not just our state we have to think about, it's about Australia. And I'm looking forward to having those conversations. We very much, as Dr. Chan and I said some weeks ago, when your largest state faces a major outbreak of this nature, and the second largest state is also, admittedly to a much lesser extent, going through challenges, it is a national issue and we need to move forward respectfully and also with confidence. We know what works, we know what we need to do, and that's why I'm appealing to our citizens and thanking them for getting vaccinated, because that is a positive way in which we can deal with our situation, but also ensure more freedoms come mid-November, come the end of October, as the vaccination rates increase.
Following on with the schools from a regional level, obviously Sydney's numbers are quite high. With return to school, will you be looking at more of an LGA type approach or a statewide approach? Obviously, when is it looking like communities like the Central Coast will be able to return to school? And secondly, when will our HSC students be able to access Pfizer vaccines?
Yeah, certainly. So in relation to vaccinations for young people, obviously in September we're getting many more doses of the Pfizer vaccine, which high school students are able to access. So obviously we're looking forward to that process. But in relation to schools in the rural and regional communities, as the Deputy Premier said, and as the health experts, Dr. Chand and other health experts have said, it really depends on what the case numbers are doing in regional and rural communities when we're moving forward. We have used a model in the past where there's been a separation between Greater Sydney and the regions, and if that is safe from a health perspective, we'll continue to do that, but it really depends on the health advice. So all I want to say to our rural and regional communities, especially in relation to schools, is keep working hard, keep coming forward and getting tested, keep getting vaccinated. The lower the incidence of disease in the regions means there are greater opportunities, but again, that's advice we'll take from the experts.
I think 5 times now you've incrementally tightened the restrictions in New South Wales. You backlipped on things like essential workers list, closing retail, the 10 to 5K rule. We're still at 681 cases today. You said yesterday that you have had and still have the right settings in place. How can that be the case when cases keep skyrocketing?
Oh, look, as we know, the settings are one thing, and as Deputy Commissioner Warboy said, unfortunately, quite shocked me. I ask him every morning how many people left their house when they shouldn't have left their house or didn't have a reason. No, it's not. It's still concerning that more than 300 people were out and about for the wrong reasons yesterday. However, I will also say this, that if there are any opportunities, and every day, can I say this without exception, every day, the health experts, the police, we have conversations together about what we can do, what we might need to do moving forward. They are ongoing. If at any time the New South Wales Government receives advice that we should do more, if at any time the New South Wales Government gets advice as what we need to do, if there's more we need to do, of course we'll take that advice. We have no fear in taking any decision we need to get the case numbers down. But I also need to make it very clear that the Delta strain works in ways other strains of COVID didn't. And I'm sure the community would want confidence that every time we ask them to do things, it's going to have the desired effect. And that is why we make sure we get the best advice from health, the best advice from police, and the best advice from the experts we work with. And if all those experts give government advice that there is more we need to do, of course we'll do that. And I think it would not make sense to say that this is it forevermore during the pandemic. You always have to keep moving. The virus keeps moving. The virus keeps teaching us things, lessons we don't necessarily want to learn every single week. And we need to take all of that in stock. Now, one thing that's been very consistent, unfortunately, depending on how you look at it, is that the high number of cases have remained in the same areas within Greater Sydney. And that is something we continue to look at. And we know there are challenges and opportunities to arrest that, but it's been a statistical fact that the high number of cases have been in the same parts of Greater Sydney. And if there are any opportunities for us to do more in those communities, apart from the work we're doing now, of course we will. Of course we'll take that advice, because it's really critical to make sure that we keep learning and keep moving forward. And if there's any advice that comes to do more, of course we'll take that without hesitation and without looking back.
Pfizer doses that you mentioned, on the rush to use those Pfizer doses you mentioned from Poland, you mentioned there's a 2.5-week period. Is there a risk that some of those doses might expire before we can use them?
No, there's no concern whatsoever. And the more than 500,000 doses that we received from the Commonwealth are on top of the 100,000 we're planning to give to authorised workers in those communities this week anyway. So in all, in the next 2.5 weeks, there'll be around 630,000 people receiving the Pfizer vaccine between the ages of 16 and 39, which will give us a huge boost in reducing the spread and also protecting those workers when they're in their workplaces and also protecting their families. But I also want to again stress and remind the community that once you get the jab, your first jab, it takes between 2 and 3 weeks for it to have effect. So at all times, even for us, for those of us that are fully vaccinated, when most of the community isn't fully vaccinated, we still have to assume that we've got the virus or that we can give it to others. So until we get to that critical mass of vaccinations, all of us have to continue to be careful, and we also have to remember that it does take between 2 and 3 weeks for the first jab to take effect in terms of protecting you, protecting your family, but also reducing the likelihood of you spreading it to everybody. Who hasn't asked a question? Who hasn't asked a question?
Regarding the back to school plan.
Who hasn't asked a question? Sorry?
Premier, why are we still talking about August 28? Isn't that giving false hope to people when it's obvious we're going to be here a lot longer? Realistically, how long will this lockdown last?
Well, I think it's really important to say to the community, we want to give them a strong flavour of what September and October looks like, and we want to provide as much certainty as possible, and that's why next week we'll be conveying to the community what September and October looks like. But suffice to say, until we hit 70% double dose and 80% double dose, life will be challenging for us. And whilst we get to those high vaccination rates, we desperately want to see the case numbers come down. We don't want to see exponential growth. And if there's more we need to do in those areas of concern, of course we will. But we need to make sure every decision we take is going to have the impact that we want, because we know that during the next 2 months, not only is it important to provide people with the incentive to get vaccinated, and by giving them opportunities to do more things they can do than today, but also to make sure that people know they're safe, to keep them out of hospital and to stop those deaths. And that's why it's really important for us to have that double focus, getting the vaccine rates up, getting case numbers down, and I think most people get that.
Just a permit question before about education. So what you're saying is homeschooling is dependent on whether 12-year-olds to 16-year-olds get the vaccine?
Look, I don't want to say that's what it's dependent on, but I do want to assure the community that health and education are working very closely on what a safe return to school looks like and when that might occur. And certainly getting kids back to school and getting workers back to work are priorities for us, which is why we started vaccinating HSC students in those areas of concern some weeks ago, knowing full well that we want every student to feel as confident as they can when they sit for their exams. And obviously they're going through a particularly difficult time. We want to make that time as easy as possible. So going back to school is a program we're working on at the moment. And as soon as Dr. Chant and our health and our education experts give the tick off to what we can talk about publicly, we will. And we appreciate, and I can't state enough, I'm not in that situation, but I know from people who are, the stress of having to homeschool and trying to work and manage a household and go through the stress of lockdown is huge. And anything we can do to alleviate that stress in a safe way, of course we look forward to doing.
You said in your opening remarks that we need to learn to live with Delta, but don't take that you're not committed to driving cases down. What are you looking at in terms of case numbers? Do they need to get into the 10s, 30, 40 before you feel comfortable with opening up if vaccination rates keep hitting their target?
Well, look, obviously we want the case numbers to be as low as possible, because if they're reasonably low, you can have much more freedom than what we do today. You can get closer to what life looked like before the Delta outbreak.
What is reasonably low?
Well, that is advice that we take from health. So Dr. Chant, so Dr. Chant will give us advice as we move closer to those targets. When we get to 6 million jabs, or just before then, Dr. Chant and her team will give government advice on what are safe things to do for vaccinated people. She'll give us advice at 70% double dose, what is safe things for us to do, and she'll give us advice at 80% on what are safe things to do. And her advice will depend on what the case numbers are doing at that time, as well as the vaccination rates. And I think people understand that. But I do want to stress that when we get to those vaccination targets, life will feel and be much better than it is today, but we don't want to expose all those unvaccinated people to the threat of getting the virus and ending up in hospital because they're not vaccinated. So the quicker we can get to those targets, the quicker we can have freedoms and the quicker we can live life safely. And these are all decision points and conversations we've already started to have. And I'm really keen to make sure people have a sense of what September and October looks like, and then obviously moving forward what life looks like once New South Wales is 80% vaccinated. But the challenge also is for us that those vaccination rates will be exciting things to look forward to, but they will also have to be measured against the case numbers, and we certainly want case numbers to be lower than what they are now. We want them to be manageable for us to be able to have more opportunities for freedom, but there will be some freedoms no matter what. But that will depend on...
Why does it take 9 weeks to get that health advice?
Obviously, it takes that long to get our vaccination rates to 70 and 80%, as I've said. Those opportunities come when we get the vaccination rates higher. And I think everybody in this room and at home would know how much I've been pushing for vaccination even before the Delta outbreak. Higher vaccination rates are key to us having those opportunities. Sorry, that's okay. I'm sorry? Oh, certainly, yeah.
So we've seen cases continue to rise, and we've also seen the compliance infringements continue to rise. Can you just explain to us how much of the new cases, or the cases we're seeing recently, are due to people doing the wrong thing, and how much continue to be because people are going about their business, going to work?
Sure, thank you. As the Premier has outlined, the vast majority of cases that we're seeing at the present time are coming from those LGAs of concern. And we have a particular concern around Western Sydney and Southwestern Sydney. And the vast majority of people are doing the right thing. What we are seeing is that transmission occurs so easily in households. As the Premier has said, the Delta variant is so transmissible. And what we've learnt this year with Delta, as is different from what we experienced last year, is that once it enters a household, it spreads rapidly. And so one of the major drivers of the higher case numbers that we're seeing in the areas of Southwestern Sydney and Western Sydney is larger households that we're seeing. We're seeing younger people and who are often those authorised workers, those people that provide essential services, who work in aged care, who work in disability, who work in healthcare settings, who work in factories, work in shopping centres. And so that transmission is happening between workplaces and households. So for the vast majority of people, it's not anybody doing the wrong thing. It's what we are seeing with this Delta variant that is so highly transmissible. And that's why it's such an important message for people, particularly in those areas of Southwestern Sydney and Western Sydney, to please come forward for testing if you have even the mildest of symptoms. And why we're really focused on getting access to vaccination. And this latest injection of Pfizer is so important. And that's why we're focusing on that 16 to 39-year-old age group in those 12 LGAs. And particularly, I want to see that the young people from the Southwestern Sydney and Western Sydney area come forward for vaccination as soon as possible. And I'd encourage anyone in that age group, and particularly from those areas, if you haven't already booked in for your vaccination, please do so as soon as you can.
119,000 tests.
But my question is, what percentage of those are surveillance tests that are compulsory, and what percentage are actually people who have symptoms? And is it possible that the heavy numbers of surveillance testing is actually skewing our results?
Yes, thank you for the question. Certainly with the surveillance testing that is in place for 3 LGAs where we are seeing particularly high numbers, that is a contributor to the high numbers of testing. And certainly it has been useful to date in that we have picked up cases who are working in aged care facilities, who are working in hospitals, and that has been important. However, we are aware that the current rates of testing place a great burden on our labs, and we are also conscious of keeping turnaround times as quick as possible because we want to make sure that the access to timely results for people who might be symptomatic in the community, that turnaround time is kept as short as possible. So there are issues that we're constantly reviewing and making sure that we do our best to get the right people tested with the right kind of test in the right place. And so, for example, one of the initiatives together with the Commonwealth is about having access to rapid antigen testing in certain settings. And I understand that many industry groups have already taken that up in workplaces, which is terrific, and also being looked at to be rolled out in aged care settings. So we're absolutely looking at the access to testing and making sure that we do our best to get the right kind of tests in the right settings to the right people.
Dr. Chant yesterday spoke about the reproduction rate of 1.3. Are you able to actually narrow that down, that the reproduction rate is higher or lower, for instance, in the authorised workers in the LGA, in the LGAs of concern?
Look, the reproductive rate does vary geographically, and so that's something that we do look at and is very much a driver about decisions that we make around where we think the areas of greatest transmission might be. But as Dr. Chant said yesterday, our key focus at the present time is driving that R effective down below 1, and that's our absolute focus. We have to get those case numbers down. And as I mentioned earlier, we are particularly concerned about the major drivers of those higher rates of transmission in Western Sydney and Southwestern Sydney. And that's our primary focus at the present time, or one of many areas of focus, to really drive that rate of transmission down in those areas. And that's why it's so important for all residents of New South Wales, but particularly those in those LGAs of concern, to follow the public health orders. Do not leave home unless you absolutely have to. Do not visit other households. Get tested as soon as you can. And please get vaccinated with any vaccine that's available to you as soon as you possibly can.
Dr. Can I ask about special health accommodation?
Testing and that capacity issue. Are we sending tests to Melbourne labs to get them processed? And also, at what point with our capacity at the moment, obviously staff are being pulled out of hospitals to vaccinate. We've just recruited our private hospital staff into the public system. At what point do we need to rely on other state staff to come and help us with our A, vaccine rollout, B, testing regime, and C, overwhelming hospital capacity?
Thank you. So I'm not across the detail of tests being sent interstate. I am aware that a number of the private labs, when they do have testing and labs in other states, that may be part of their processes. But look, I can assure you in New South Wales we have absolutely surged our efforts in terms of contact tracing. We have redeployed staff, grown that capacity, and as and when needed, we'll call on assistance from other states, as has happened to date. And certainly for vaccination efforts across the state, a number of staff have been redeployed, are surging their efforts, and are working incredibly hard to deliver vaccination at the scale that we need to, particularly to deliver those 500,000 doses in this next 2.5 weeks. And so there's a lot of people who've been working extremely hard, and I'd like to just take this opportunity to say a big thank you to all of them as well.
So Dr. Gill, just on a special health accommodation.
Queensland's been doing it for changes to be made there to help those border communities, maybe moving that border effectively south. Are you going to comply with that? Are you going to agree to that?
No, look. Can I say to the communities of the Northern Rivers, especially Tweed, if you move that border, that cliff edge becomes another border for another community, and when you start dividing up New South Wales, you'll cause more problems than actually solving solutions. So for us, the Cross-Border Commissioner and James McTavish is working with our Queensland counterparts to make it easier for access across the border, especially for those critical supply chains, especially around food, and of course essential workers. So we'll focus on that. The border cannot move and should not move because there'll be unintended consequences that'll have actually worse and more negative adverse outcomes for the broader part of the Northern Rivers area.
Last question, please. Are extra resources being sent there now? Obviously everybody in the town has to be tested.
Yeah, absolutely. I mean, one of the things that we've done really well from a New South Wales health perspective and from our LHDs in the regions, it is a network of local health districts, and so the resources have been focused in priority areas, and Wilcannia, of course, is of great concern. We're getting consistent numbers each and every day in relation to infections. We know there was an event of people, of a gathering, that may have played an important part to that. So testing, the ability, as we did recently with the Royal Flying Doctors flying into Wilcannia, vaccinating a large number. I think last Saturday was about 320 vaccinations on Saturday. They were there for a couple more days, so we can get an update on how many more people have been vaccinated in Wilcannia. So that's our approach, no different to Dubbo, no different to Walgett, no different to those regions of concern in regional and rural New South Wales. I'll come back to you. Yeah.
Did Crisis Cabinet decide on the regional permit eligibility criteria?
Oh yeah, absolutely.
What are they?
Yeah, absolutely. And later today we will put out the details, and it'll be online. But I can update that the permit to leave Sydney has been decided. The arrangements and the criteria. Don't forget, firstly, we made some announcements earlier in the week as part of Commissioner Fuller's new powers and new governance arrangements, where no longer can you go to your second residence for a weekender. You can only go to a second residence if it's for care and maintenance of urgent works, or, of course, for animal welfare. And if you've got to leave to go to the regions to a second residence for work, it has to be, again, be priority. If you've got to go to the regions to purchase a home, not an investment property, and there is no other option but to inspect that home, that'll be permitted. But outside of that, you won't be able to go to the regions. So on top of that, what we've now done is the permit system kicks in on Saturday. All workers leaving Greater Sydney will now need a permit, and further to that, they will need to be COVID tested for the previous 7 days before they actually go to regional and rural New South Wales. To make it easy, we're redefining Greater Sydney and excluding Shell Harbour and the Central Coast. So from here onwards, the Central Coast and Shell Harbour will be treated as regional. So if you're travelling from Sydney to the Central Coast or to Shell Harbour, you will need, of course, a permit. And that's at the key of making sure we simplify it, make it easier for governance, and making sure for police surveillance and the ability for police to act on it. That will simplify the message for everyone.
Just on Wilcannia,